about just getting people healthy and happy again. Because we're seeing patients who think, no one can help them. They have to live on painkillers, they have to live on antidepressants. That, a lot of these patients have been told it's all in their head. It is in their head here. It's helping those people who feel they can't be helped. There's a lot of people out there that there is a genuine problem. It just hasn't been identified, or the patient hasn't been listened to. If you think about it from your own perspective, if you're in pain, you're not going to sleep well. Don't sleep well day in, day out, week in, week out, month in, month out. What's the domino effect on your body, on your health, on your mental state? And these are the sort of patients we're seeing, and it's incredible the feedback we're getting, the cards, the letters from these patients, because they thought they have to live with this for the rest of their lives, and they don't.
Well, it's a very great sense of satisfaction being able to help people in chronic pain. You're literally changing their lives, because people are living in chronic pain. It's affecting every aspect of their life, their work, academic, their social life, their sleep quality. This is why Wally and myself opened up the TMJ Centre, so that you can overcome your pain and live a life free of pain.
We've both been looking at the same things and been talking to the same researchers, reading the same books. Yeah, it's gone from there. And then I've taken Jonathan along to dental courses, and he's taken me along to more non-dental courses, and now we just realise it's a massive area, and we don't just work together. Like, for example, it may be a dental and a chiropractic problem, but it also might be an ENT problem. We might need a podiatrist, we may need a nutritionist. There's a whole heap of other specialists that we work with, but the key is identify the problem and knowing how to identify the problem, so then we know whether we can help them or whether we need to refer them out to someone else who can. So as the dentist at the TMJ Therapy Centre, I'm kind of looking at broadly everything initially. So from the moment they walk in, how they're walking, how they're holding their head, how they're holding their neck, what angle is their head at, how are the teeth wearing, what are the shape of the jaws and arches, what are the eyes doing? Because everything's connected. I'm looking at everything, because everything starts from day one, from the moment you're born. How you breathe, how you function, then has an effect on how the jaws grow and develop, and how the effect on this joint here. And so my role is to get this area right, and then I rely on the help of my colleague, Dr. Jonathan, to look at the rest of the body. When we set up this practice many years ago, it was really, really important to set it up in a way that makes people feel comfortable. I was so blessed to have fantastic staff, and they go out of their way to make you feel good. The priority is the client. So when you're here, it's about making you feel calm, making you feel happy. So when you're calm and happy, you're going to be more receptive to treatment, because when you're tense and uptight, then there's always a barrier there. So we want to break down the barriers. We want to find out where the problems are and to try to deal with those issues. If you've been in real pain, if you haven't been able to sleep properly, if you haven't been able to function properly, as soon as you flick that switch and now you're out of pain and you can sleep properly and you can start functioning properly, that's a big life changer.